Congratulations on your purchase of the Fiix Elbow program. My name's Tim and I'm a co-founder of Fiix Body and a sufferer of tennis and golfer's elbow for over 7 years. So I understand what you're going through. Now I wanted to do a quick review of what's coming in the mail, what you'll receive in a couple days. But the best way to get started is to download the app and set up an account. Now the app is a critical component throughout the therapy because it guides you through the therapy, tells you what to do, tells you when to do it, and then also will map out your progress and show how you're doing through the 8-week therapy. Now for those of you that are digitally challenged, we also have therapy cards. So there's 5 cards printed front and back that will also give you the same similar information that's in the app. The Fiix Elbow is a 2-part solution. It's 1 part therapy robot. This breaks up the scar tissue and adhesions, and then 1 part program and exercise routine that takes you through the 8 weeks. So when you receive the Fiix Elbow, the first thing you're going to notice is how heavy this robot is. It's heavy because we designed it with a commercial grade motor that has enough torque to break up the scar tissue and adhesions in that tendon. When I use it, I always support it with a pillow. It makes it a lot easier. So the first thing you're going to do is you're going to grab the emollient and you're going to put just a little bit either on the outside for tennis elbow or on the inside for golfer's elbow. There's enough emollient in here for over 100 treatments. You'll go through 24 treatments in the 8 weeks. So whether you're treating multiple tendons or the condition comes back, you'll have enough emollient to take care of your elbow. So to get started, it's pretty simple. You turn the Fiix Elbow on with the switch on the bottom side, and then there's 3 buttons. There's a time button where you can adjust the time. Your first therapy is 5 minutes, every other therapy is 10 minutes, so you only use this at the beginning. Then there's a stop button and a play button. So as I said, I grab a pillow, and then you can adjust the arm strap. I go through a separate video for both tennis elbow and golfer's elbow that'll show you how to use it, exactly where to use it. But basically, you pull the strap and this will increase or decrease the tension. I recommend to start with it a little bit lighter in the beginning and then you can increase tension as you get through the therapy. But then from there, I just turn it on and then I let it sit on its side on the pillow. I go through a couple techniques where you can make a fist and adjust it to increase intensity, but that's all detailed out in a separate video. Okay, so let's talk about the 8-week program. So the 8 weeks of therapy we break into 2 sections. The first 4 weeks we call the breakdown phase. That's where we break down that scar tissue and adhesions in the tendon, and that can increase the tenderness, so your pain might go up a little bit. It's actually a good sign. It means that your body is reacting to the therapy, and then from there we'll typically see the pain decrease. So the first 4 weeks is the breakdown phase. The second 4 weeks we call the build-up phase. And what we do there is we add a strength component. So as your tendon's starting to heal, we add some strengthening exercises. We're not building up a big muscle, we're just strengthening a tendon. But we give you some exercises to do with a hammer or a dumbbell or a tendon strength handle. And that period makes that tendon stronger so that it keeps the pain away long term. So that's the first 8 weeks for your therapy. Then we call the next 4 weeks your recovery phase. And that's where we leave the tendon alone. We stop the therapy and that scraping technique on the therapy, which allows the tendon to heal properly. Now we get the gamut of people where some people in the first couple weeks feel better. The majority of people feel better in weeks 5 through 8 during that build-up phase. And then some people go through the full 8 weeks, don't feel any better, but miraculously the pain drops once we stop the therapy on that tendon. In that recovery period, we do encourage people to continue stretching, and you can do the strengthening exercises if you like, but be patient. And if you see a decrease in pain initially, you really need to continue with the therapy through the full 8 weeks. That's how you fully heal that tendon. If you have any questions during the therapy, you can either check our FAQs online, you can email us, or call us directly. We're always interested in talking to customers. Good luck getting fixed.